Measles was declared eliminated in the United States in the year 2000. It took 26 years of really hard public health work to get there. And it has taken Donald Trump's Department of Health and Human Services roughly 18 months to unravel all of that hard work. The CDC confirmed today that measles has now spread to 43 states with 2,318 cases recorded so far this year. We are only in July, and that number already exceeds the total for all of 2025, which was itself the worst year for measles in this country since 1991. Only 7 states have yet to report a confirmed case, and the real figure is almost certainly higher than the official one. State epidemiologist Dr. Leisha Nolan says modeling and genetic analysis suggests the outbreak along the Utah Arizona border may be 3 to 4 times larger than what has been confirmed. The case count alone does not explain how we got here. In January, the CDC cut the childhood immunization schedule from 17 recommended vaccines down to just 11. And it did so by going around the very advisory committee that has handled that job for the last 3 decades. A federal judge blocked the change in March, ruling that the administration had likely broken the law. Judge Brian Murphy wrote that bypassing the committee signaled an abandonment of the technical expertise that committee exists to provide. The man who oversees that department is, of course, Health Secretary Robert F. Kennedy Jr. When a member of Congress asked him under oath whether he would vaccinate his own child against measles, Kennedy had this to say.
I don't want to seem like I'm being evasive.
Yeah.
But I don't think people should be taking medical advice from me.
Right. No.
That pretty much tells you everything you need to know about RFK Jr.'s worthlessness in running this agency. In fairness, HHS says its leadership has consistently described the MMR vaccine as the best available protection against measles. And Kennedy finally urged vaccination at an outbreak site in Virginia last month. Unfortunately, his years of anti-science rhetoric has already created far too much damage. Measles infects 9 out of every 10 unvaccinated people who are exposed to it, and it lingers in a room for up to 2 hours after an infected person has already left. Stopping it requires a community vaccination rate of 95%, and there is very little margin below that number. Dr. Mark Roberts, who formerly directed the Public Health Dynamics Lab at the University of Pittsburgh, argues that skipping a vaccine is nothing like skipping wearing a seatbelt. He compares it instead to driving a car with no brakes, because the person that's going to get injured is not you, it's whoever happens to be in front of you. If you prefer a government that isn't led by anti-science quacks, give me a follow because you're my kind of people.